Hi, my name is Shannon Studden, and I am a Senior Program Specialist with the National Rural Health Resource Center, and I would like to welcome you to the Advanced Nursing Education Workforce, or a new webinar series on transitioning to practice. This series is offered by the National Rural Health Resource Center through an agreement with the College of St. Scholastica and funded through the ANU grant offered through the Bureau of Health Workforce within the Health Resources and Services Administration. The purpose of this series is to provide advanced practice nursing students and recent graduates from the College of St. Scholastica's Rural Academic Practice Partnership, a new program, with tools and strategies to help smooth your transition into practice. In this webinar, we'll give you some things to think about as you look for and evaluate potential practice opportunities. Angie LaFlamme is my colleague here at the center, and she has a great deal of experience and expertise in the healthcare workforce field, and she will be our speaker on this webinar. So I'll give you a little bit of background on Angie, and then I will turn it over to Angie. She joined the National Rural Health Resource Center in 1996, and she has over 20 years of experience in healthcare provider recruitment and retention and healthcare workforce. In her current role as a program specialist, she provides technical assistance, education, tools, and resources to state flex program grantees in support of successful outcomes and sustainability of critical access hospitals across the country. She also works with the state Small Rural Hospital Improvement Grant Program grantees, supporting rural hospitals across the country in the transition to value-based care and population health. So thank you, Angie, for being willing to share your knowledge with us, and I will turn it over to you.
Great, thank you so much, Shannon. And I'm really happy to be here today and be able to talk with you a little bit how to evaluate rural practice opportunities. So the National Rural Health Resource Center is a nonprofit organization, and we are dedicated to sustaining and improving healthcare in rural communities. And as the nation's leading technical assistance, knowledge, and rural health, we focus in 5 core areas, and those are the transition to value and population health, collaboration and partnership, performance improvement, health information technology, and also workforce. So this is what our agenda looks like today. We're going to start off talking a little bit about the changing healthcare environment. We'll move to the Minnesota Nurse Practitioner demographics and distribution. We'll touch on the advantages of a rural practice. Then we'll get into practice evaluation. We'll talk a little bit about loan repayment programs, the 3 RNet, and then we'll provide some resources for you at the end of the presentation. So before we get started today, I'd like to get on the same page about what we consider health is. And the World Health Organization had a definition that I really liked, and they define health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So there's many dynamics driving the changes we're seeing in healthcare today. There's a lot of activity around population health, care coordination. There's a lot of movements in hospitals transitioning from value-based payment to value-based payment. And then there's the ongoing workforce shortage. And so in order to meet these requirements, the requirements of these changes, we need to rethink how we define health. So let's talk just a little bit about each of these 3 areas. So population health and care coordination. In order to achieve population health, it takes a wide variety of partners working together to help coordinate patient care. And in addition to traditional partners such as hospitals and clinics, there's many other organizations that need to be included to ensure better coordination of care. And some of these organizations include places like EMS, your faith-based organizations, long-term care, public health, social services, government, schools, etc. And so by using these key partners, that's when we can achieve better patient care, better health outcomes, and also we can lower costs. Talking a little bit about value-based payment, aside from population health and care coordination, another change we're seeing is that transition to a value-based payment system. That's a model that's beginning to take shape. Currently, most healthcare providers are still currently being paid by volume. So in other words, the more patients they see, the more money they make. And volume-based pay is a business model that's really led to high cost, low quality, high chronic illness, and also low access. So the pay for performance model, or what we would refer to as a value-based payment system, offers financial incentives to physicians, hospitals, medical groups, and other healthcare providers for meeting certain performance measures. And this is a business model that will lead to higher patient satisfaction, higher quality of care, improved outcomes, and also will reduce costs. Another driver that is changing the healthcare. I'm sorry. Another driver of change is the healthcare workforce shortage, and some of the factors that are driving this healthcare provider supply and demand include things like the aging population, population growth. We have provider retirement. We have the increasing pace of medical advances, the lengthy time required to train healthcare professionals, the availability of training programs, and on the bright side, we do have new emerging healthcare professions. Some of those include things like behavioral health technicians, care coordinators, community paramedics, dental therapists, navigators. They're certainly helped to fill some of the gaps to ensure population health. In 2016, a study done by the Health Resources and Services Administration cited the 2013 through 2025 supply and demand of nurse practitioners. And this study indicated that there will be a 19% increase in need for nurse practitioners across the country in just the next 5 years. Looking at Minnesota specific data, there are roughly 4,000 actively licensed nurse practitioners in the state, and 26% of those nurse practitioners are over the age 55, and this is a percentage that grows each year. Results from the 2017-2018 Minnesota licensure survey indicate that 27% of Minnesota nurse practitioners indicated that they have plans to retire within the next 10 years. Here's a look at the geographic distribution of Minnesota nurse practitioners. And you can see from the numbers that there are far more nurse practitioners practicing in metro, micro, and small towns. In Minnesota Metro, there is one nurse practitioner for every 277 people. And then looking at rural Minnesota, there is one nurse practitioner for every 1,987 people. So that's almost 7 times as many as the metropolitan. And Minnesota is not alone in this workforce shortage. Similar data and statistics are being gathered across the country. So now that we have maybe a little bit better understanding for the need of healthcare providers in rural, let's also talk just a bit about the advantages of a rural practice. So when you work in rural, you oftentimes have greater autonomy and a little bit more independence, able to have your own style of practice. You may be able to see patients at your own pace versus being told that you need to see X amount of patients per day. You may be able to have a little bit wider scope of practice if desired. Recruitment incentives tend to be more plentiful in rural areas. Living in rural oftentimes comes with a lower cost of living. Loan repayment opportunities are also more plentiful in rural areas, and we'll talk about loan repayment a little bit later in the presentation. And let's see, there's plenty of technology these days, which helps rural providers in not feeling so isolated and having more access to things that the metropolitan providers have access to, things such as resources for continuing medical education, networking opportunities, telemedicine, health information exchange, telepharmacy. And then finally, there's rural health networks. Many rural hospitals and clinics are part of rural health networks, and being part of a network can provide a lot of support to small rural hospitals. Things like it can help in group purchasing, shared services such as specialists or equipment. It provides a platform for collaborating on solutions, sharing knowledge, and also can provide some increased influence. So those were a few advantages of working in rural. Let's now start talking about how to begin your practice search. So before you begin your practice search, you need to develop a clear picture of what your ideal practice and community look like. And so you need to clearly define things that you feel like you must have, and then also things that you would just like to have, as well as knowing what you absolutely don't want. And this can be a time-consuming process, but it's essential to give it the attention it deserves. So in defining your practice search goals, here are some of the things to consider. So there's many variables to consider when choosing that perfect place to live and to work. And so when thinking about a geographic location, you want to consider things such as your current lifestyle, what type of population you want to live in. Does the area have a stable economic base? Are you looking for a certain climate, a certain culture? There's lots of landscapes to consider. Do you like desert views? Are you more of a mountain person? Maybe you like tropical, coastal, farming. Maybe it's lakes and forests. So those are things to consider in the big picture. Reeling it in a bit and kind of looking at the smaller community area, things that you want to consider would be things like the community perception, how far to the nearest larger city. Pay attention to crime rates, the affordability of the communities. What's the housing market look like? What's the price of gasoline, property taxes, and such? Is the community going to provide employment for a spouse or a significant other? Does it have ample restaurants, shopping, if those things are important to you? What does it have available for schools, religious opportunities? Something you might want to consider is the proximity to an airport. What type of entertainment or recreational activities does the community offer? So all things that you want to consider and take note of when developing kind of your list of must-haves or things that you really want in a community where you're going to be living and working. So in defining your practice goals, determining a practice setting that's a good fit for you is really important, as each one is going to offer just a little bit different type of work experience. So the different types of practice settings might include a single specialty group, a multi-specialty group. Maybe you're going to be working in a hospital or in a private or solo group. Maybe you want an academic setting. Maybe you have interest in being part of a health system or in a partnership. And maybe even just a locum tenens where you're traveling across the country, filling in for places that are in need of nurse practitioners. That would really offer the advantage of getting to experience different cultures and regions within the state or the United States. Other things to consider would be technology. So before you go out looking for a position, you want to determine what kinds of technology are important to you, or what are the things that you're going to need to grow your practice. And so some examples might include telemedicine, electronic prescribing, patient portals. Do you want easy access to ultrasound, MRI, CT scans? And then moving to compensation, one thing that I would really advise is never to pre-select practice sites due to the compensation being offered. Money really should not come up until you're down to a few different locations where you've done your site visits and you've been offered a job. You're kind of weighing the pros and cons of two places, and if they're pretty comparable, then that's where salary could probably come into play. And the reason being is you're going to be signing an employment contract or an employment agreement to work at this facility. Typically the agreements can, they can be for a year, 2 years, 3 years, and a practice search is a lengthy, it's a time commitment. And oftentimes you might be moving a family, and so it's there's a lot that goes into it, and to choose a place on compensation versus whether it being a good fit for you and your family, it could make that year, that 2 years, or even that 3 years in a signed contract feel like a really long time if you're not happy there. When thinking about compensation, though, consider the entire compensation package, not just the salary. So think about things like the length of the guarantee, if there are any production incentives, what does the benefit package look like? Are they offering a signing bonus or any type of loan repayment? So once you've determined your geographic preference, your communities of interest, and the type of practice setting that you're looking for, now you can begin to look at specific healthcare organizations to visit. And here's some things that are really important to consider during your interview. So one of them being fully understanding the mission and the vision of the group. In an era of health reform, providers need to understand the vision of the hospital or health system they'll be joining. So really important to make note of that. Identify the services the organization has to offer and the volume of patients that they see. So what types of services do they provide? Do they provide things like acupuncture, lab, radiology, mammography, physical therapy, occupational therapy, what are a couple other ones? Nutrition services, speech therapy. So determine what types of services that you would like to have easy access to. And then also, what is the patient volume? How busy are you going to be? Are you going to be expected to see a certain amount of patients per day? Or can you see patients at your own pace? Also important to understand the organization's referral and transfer relationships, and then also your access to specialists. So finding out whether or not there are any formal relationships or transfer agreements in place with the organization. Do they have local specialists or do they have visiting specialists? Maybe they have a cardiologist that visits the community once a week or once every 2 weeks. And then maybe they have telemedicine available too. So that's something to certainly ask about. And then also getting familiar with the admitting hospital. So looking at things like how many beds is the hospital? Do they have any psychiatric beds? What type of services does the hospital provide? And then what's the perception, the hospital perception from the community standpoint? What type of reputation does the hospital have? Do the people in the community utilize the hospital, or do they go outside of the community to another hospital? And if that's the case, that'd be some red flags you may want to look into. Additional things to identify during your site visits would be what your performance expectations will be. So again, what's your patient volume? Understand fully the scope of practice that's going to be expected of you. What is your call schedule going to be? And then is that going to be equitable between you and your colleagues? Will you be given any administrative duties? And then also there's always a potential in rural for additional practice locations or being part of a team. So you may be practicing in a satellite clinic 1 day a week or an urgent care. Maybe you will be part of a care coordination team. So things to find out when you're visiting different facilities. Also paying attention to the facility's infrastructure. So what's the condition of the facility? Do they have a recent or planned renovation coming up? If you're trying to grow a new practice and you sign on with a facility that in 2 weeks is going to go, under a 5-year overhaul of the whole campus or the whole hospital, that could really impact the growing of your practice. So good to know if they have any renovations planned or if they just finished one. Also, are they going to provide you with adequate space and the equipment and staff that you're going to need to grow your practice? It's always good to find out too if the organization is affiliated with anyone or if it's part of a network. We talked about network affiliations earlier and how they can provide additional resources, education, experts, equipment, and financing. So good to find out if there are any affiliations or if they are part of a rural health network. And then also, what does the organizational structure look like? So is it an independent organization? Is it part of a health system? Who manages the clinic operations and how is the organization governed? Is there a medical director? Is there a board of directors? Who's going to be making the management decisions? Who will approve your time off and do your performance evaluations? So get a good sense of what the organizational structure and the leadership structure looks like at the facility as well. Switching gears just a little bit, I want to touch on organizational culture. Organizational culture is so huge. And so during your site visit, be sure to ask questions about the culture characteristics. Some of the things would be for you to have a clear understanding of the mission and the values. Does it seem like it's a team-focused environment? Is the leadership collaborative? Do they have clearly defined accountability across roles within the hospital? Do they appear that they readily adapt to change? Do they provide transparent communication? Did they give you clear performance expectations? And do they seem innovative in their approach to care? Something to remember too when you're interviewing for a job is you are also interviewing the organization to see if they will be a good fit for you. So really don't be afraid to ask questions when you're there. Like I said, you want to ensure that this is going to be a good fit for you and your family. And so you are interviewing them just as much as they're interviewing you. And so some examples of questions that you could ask are, what is the reason you're recruiting? Was someone let go? Did someone leave? Are they just busy and they need additional workforce? Always good to find out what's the reason for the opening. Talk to them about the turnover that the group has experienced. Ask them how the healthcare facility is regarded in the community. What's the community perception of the facility? What does your onboarding process look like? What's the leadership style? Ask about how they would describe the culture of the group. What's the best thing about working here, you could ask. And then also, what's the most challenging? So be sure to ask questions. The 3RNet is an acronym for the National Rural Recruitment and Retention Network. And they are a national nonprofit network of members committed to matching healthcare professionals with rural and underserved jobs across the country. And what's good about, well, there's lots of things good about the 3RNet, but if you are someone who is looking to practice in another state and you don't know much about the state, the 3RNet can be an extremely valuable resource. You log on to, it's just 3 and then the letters rnet.org, and you click on the state of interest, and up will come the contact information for someone who is really experienced and knowledgeable about the healthcare workforce in that state and will assist you in finding just the right practice opportunity for you. You can also, if you're in Minnesota and you plan on staying in Minnesota, you can certainly click on the Minnesota page and it will take you to someone there too who will help you find a practice opportunity in this state. There's no charge for you to utilize their services. It's a fantastic organization, so I would really recommend utilizing the 3RNet for your practice search. So here we get to the good part, the loan repayment programs. I'm going to touch a little bit on 3 of the programs listed here. I did put the contact information for Brenda Flotnum. She is the person at the state, the Minnesota Department of Health. She administers these programs, and for more detailed information, you can either log on to the specific websites or reach out to Brenda, and she would be happy to provide you more detail. But I'll kind of do a high-level overview of them for you now. And so the first one is the National Health Service Corps Loan Repayment Program. And this is a program that offers up to $50,000 for initial 2 years of full-time service. Full-time here is considered 40 hours a week and 45 weeks per year. If you want to work part-time, it would be up to $30,000 for the initial 2 years of service. And the criteria for this one is that you need to work in a health professional shortage area, or we call it a HPSA area, that has been given a score of 14 or higher. So the higher the score means the higher the need in that area. You can, I'm gonna forward here to HPSA map. So this is the health professional shortage area map for Minnesota. And this can be found on the Department of Health website. And this will help you to know whether or not the community that you're interested in happens to be located in a health professional shortage area. So for the National Health Service Corps loan, this loan repayment program happens to be state and federal tax exempt. So you would not owe any taxes if you were awarded. However, none of these loan repayment programs can coincide with each other. So you can apply for any of them that you're eligible to apply for, but you could only accept one award. Let's see, and this one is a initial 2-year commitment, and there would be default penalties if you didn't serve the 2 years. Moving to the Minnesota State Loan Repayment Program, this one offers $20,000 for 2 years for full-time. Full-time equals 40 hours a week, 45 weeks per year, or part-time, 20 hours a week, 45 weeks per year. This one, you need to have a permanent state license, a signed employment contract, or be ready to sign with an eligible site and ready to begin employment as soon as the loan contract is finalized. This one is also federal and state tax exempt, and default penalties will apply. The next one is the Minnesota Rural Physician Loan Forgiveness Program. And I'm going to go back to the other one. I think I forgot to mention that this one you also have to work in a health professional shortage area. But this one does not need to be in a site of for a score of 14 or higher. This has to be designated a health professional shortage area. So going back to the third one, the Minnesota Rural Physician Loan Repayment and Forgiveness Program. This program is up to $14,000 per year, and it has the longest commitment at 3 years. This one is 30 hours per week, 45 weeks per year. Now this one, you do not need to work in a health professional shortage area. This one, you need to work in a designated rural area in a city or a township outside of the 7-county metro area, and then also excluding the cities of Duluth, Mankato, Moorhead, Rochester, and St. Cloud. So if you're outside of the 7-county metro, and then also not in Duluth, Mankato, Moorhead, Rochester, St. Cloud, the rest of the state would be eligible for this program. This program is also federal and state tax exempt, and you can reapply for a 4th year. This one, I would encourage anyone in their final year of training to apply for because this program, they give preference to final year students. And after they've looked at all the final year students, if they still have slots available, then they will open it up to practicing providers. The first two, you cannot, well, you can be a student, but you have to be licensed and ready to roll. But this one you apply for in your final year of education. So you can log on to the Minnesota Department of Health website to find applications and the application enrollments when they open and when they close. And then again, also reach out to Brenda. She'll be happy to help you with any information that you need that wasn't provided here today. So in closing, I would say that it's best to keep abreast of the changing healthcare environment. I would say that it's really never too early to start your practice search. 12 to 18 months is about when most people start, but it's really never too early to start building that list of must-haves, things that you know that you want in a practice and in a community that you and your family will be living in. We talked about determining your search preferences. What do you want out of a practice to grow your practice? What type of practice setting do you want to be in? And then assess all aspects of the practice opportunity. And that includes evaluating the entire employment package, not just compensation being offered. And then identify loan repayment eligibility. Is the community that you're going to be working in qualify for any of the loan repayment programs that we just talked about? Also inquiring whether or not the organization is going to offer any type of loan repayment. Keep in mind that most loan repayment provided by a facility themselves is going to be in exchange for X amount of years of service. So something to keep in mind as well. And we didn't talk about this in the presentation, but I highly recommend having your contract reviewed before signing. You can have this done by attorneys. There are attorneys that review contracts, attorneys that specialize in healthcare provider contracts. It's kind of that old saying, you don't know what you don't know. And so if you're given a contract that maybe they're not going to offer you any tail coverage, if it's not in there and you don't know about tail coverage, you wouldn't know that that's not a contract you wouldn't want to sign. Or if the non-compete clause is not where it should be, things like that. People that review contracts know what the salaries should be, and they'll be able to tell you if it's reasonable, above average, below average for certain regions within the states. You know, across the board, family medicine physicians in Washington make different money than family physicians on the East Coast. It's just Washington State and then the East Coast. It's just a geographical difference. Cost of living is different. And so it's not a general number across the board. So be sure to have your contracts reviewed to be sure that the salary that you're being offered is competitive and within the standards within the regions of the state. So here are a couple of resources that we talked about in the presentation. The first one is my organization, the National Rural Health Resource Center. We have tons of tools and resources about workforce, along with a whole host of other healthcare topics. And so visit our website to find out about any of those. The Health Resources and Services Administration Data Warehouse. This is a website where you can go to find out whether or not a community that you are interested in is indeed a HPSA site. Brenda can also help you with that from the Minnesota Department of Health if you're looking to stay within Minnesota. We talked about the National Rural Recruitment and Retention Network, or the 3R net for your practice search. They'll also be able to help you with whether or not communities are designated HPSAs or MUAs, and that's across the United States. The State Office of Rural Health, the Minnesota Department of Health, we talked about that. That's where Brenda Flotnam is. And then the National Health Service Corps to find out more detailed information about that loan repayment practice opportunity. So with that, I thank you for joining me today. I loved sharing with you some information about how to find a practice opportunity. And here's my contact information. If I can be of additional service to any of you, please feel free to reach out to me and I would be happy to speak with you.
Thanks, Angie, that was great information. We know there's a lot to think about as upcoming and recent graduates transition to practice. So, and thank you to those of you who watched the webinar. We encourage you to check out the other webinars in this series to continue to add more tools to your toolbox that can help you smooth your transition to practice. So we're very glad that you joined us and we wish you an enjoyable day. Thanks.